Hello, my Introduction to Human Services class. I'm doing a mini lesson on the Diagnostic and Statistical Manual of Mental Health Disorders, the 5th edition. It is commonly known as the DSM-5. It comes in many, well, not in many, it comes in a big version that's a huge book, or online, or I have, for example, a little mini desk version. But it is a very important manual that is useful. It's necessary. You will study a lot about it in your future. Right now, what I want to do is just introduce you to its existence and the concept and what it's used for. And we will then go on and work on some information about specific disorders. Right now, though, what I'm doing is just letting you know about the manual itself. In 1952, the first DSM was published by the American Psychiatric Association. It was the first of its kind. It is used worldwide, and it is researched extensively before publication. It is vetted through a medical model of research, and a whole team of psychiatrists collaborate from around the globe. The latest, the DSM-5, was published in 2013. It takes many years for them to agree on each section. There's lots of arguments and debate, along with the research about putting this together. Historically, there have been absolute cases where the DSM was blatantly wrong and biased in its diagnoses, and it has a lot of controversy to its history because of this. So years ago, for example, homosexuality was a diagnosis in the DSM, and that, of course, as well it should be, came under a lot of scrutiny as to how that was not correct. So, how it's used. It contains descriptions, symptoms, and the criteria for diagnosing mental disorders. It provides a common language for clinicians to communicate about their patients, and establishes consistent and reliable diagnoses that can be used in the research of mental disorders. In providing this common language and the common criteria, you can have somebody diagnosed with accuracy for, let's say, depression in England, as well as in Boston, as well as in Scandinavia. So it provides that consistency that if a person was conducting research on a medication trial, for example, they could really be comparing people with the same diagnosis that have met the same criteria. And this is very important. It's also important so that when, for example, in our common language, we'll say, oh, I feel depressed. That is a description that we use all the time. The DSM provides very specific, a specific list of items, and says, in order to be clinically diagnosed as depressed, you must meet these criteria over this amount of time. And so it makes it all specific, and really lays it out versus I'm having a bad day, compared to a person who has reached a level of a serious diagnosis of depression. Limitations. So the DSM, it's useful, it's necessary, but it is very wise to remember that it is a tool. And it is only as useful as the person who is using it. And it can be misused or overused or underused. So I want to have people have caution about the DSM. So while it provides clarification and it can assure clinicians that they're using the same criteria, it's flawed in that there are many differences in interpretation. And so it is not as exact as we would hope. It also is not to replace clinical work of listening to clients and working with them as people. Sometimes people get very, very engrossed in learning about all of the mental disorders and diagnosing people, and they lose track of the person. Always keep the individual and the individual's life circumstances and all that we've talked about with how they fit within a family system, within a larger system. Keep that present. It is quite possible to lose sight. So in that vein, it is derived from a medical model, and it's based on treating a person as an individual patient. It comes from the world of psychiatry, which comes from medicine and doctors. And so it comes out of that history and wanting to be on par with diagnosing somebody the same as you would with an appendicitis or a heart attack or whatnot, and making sure that psychiatry was legitimized. It comes from a completely different origin than social work. However, it's a tool that is necessary and useful, and so it is used and fit into human services and social work, and you really have to understand it and have access to it in your toolbox. So the DSM-5 is used to write a diagnosis. The diagnosis is coded. So every depression or ADHD has a code number that goes with it, and the client must meet the specific criteria, the list of symptoms, over a specific period of time. The diagnosis is then used in filling out paperwork for insurance companies. And the insurance company, based on the diagnosis, allows the number of sessions that the clinician can have. Treatment is looked at in terms of medications and other research-based treatments, which are all based on that accurate original diagnosis. Now that can shift over time. A clinician can start working with a person and think they have a diagnosis and then have to adjust that, or something shifts with the client. Who can diagnose? So a licensed social worker or a licensed mental health clinician can diagnose a client. Obviously a psychiatrist or a psychiatric nurse practitioner. All are licensed to diagnose. Insurance companies can be very specific about who they allow to give an official diagnosis. So, writing up a diagnosis from the DSM-5, we are not going to spend a lot of time on this. You will cover it at different times, and then you will be specifically trained wherever you work. If this is something that, if you're at a level, a license level where you're diagnosing, you will have training as part of your orientation with your agency as to how to do this. You're also going to spend a lot of time learning about the DSM-5, and the course is called Abnormal Psychology, and you'll learn a lot about mental health disorders, and you will take it at the undergraduate level and at the graduate level. So for this course, I'm just introducing you to the book and that it exists. When I share this PowerPoint with you, you'll be able to click on this link, and it will bring you to some more detailed information about what are some things that you would put into that write-up. So please do click on that link when you're going through the PowerPoint yourself. So here's some important points to remember about the DSM. Guess what? Every single one of us can be diagnosed by this book. So it can be, we can be diagnosed. I could diagnose, I am a licensed clinician, and I can diagnose any one of you. And I would find a way within this book. So there's things called an adjustment disorder, and that is for people experiencing difficulty with life circumstances. Given the anxious time we're in right now, any one of us could be diagnosed with an adjustment disorder at this time. So know also that in each of our lifetimes, we'll experience at least one episode of a depression or anxiety or some serious setback to our mental health. Let that sink in. No one is immune to experiencing a prolonged period of time in their life when they are having a mental health disorder or crisis. It could happen at very different periods of time for people. So, maybe for a person, it's in their childhood that they have a really difficult time, or maybe their teen years. Maybe it's when they're quite elderly. The elderly really struggle a lot with depression and isolation and loneliness and some different things. So I think it's important to remain humble in this work, and it's important to realize there's a phrase that I use in my own mind, and you can find what works for you. But for me, I think, but for the grace of God go I. And I really do think about that. I think, just realize that, it could be you. Right now, you're the clinician, or you're the counselor, you're the social worker, you're the person who's on the helping side, but you may need to be the one who's being helped as well. So it's more a question of when than if, about when a person might experience a mental health concern, or really need intervention, counseling, some assistance. Mental illness comes from multiple sources. It comes sometimes genetics, extreme life circumstances, trauma, substance abuse, addiction, abuse, isolation. That's just naming a few of where some of these might come from. So that's our mini lesson for right now. It's just about understanding about the existence of the DSM-5. Thank you for listening.